Oh, hi. Hello. Just got the cleaning treatment done. So friends, why do you think that dentists do recommend this cleaning treatment? And do you think that there is some connection between this dirt which is lodged in your teeth, or if we allow the dirt to just sit there in your teeth and your heart? So come, let us today talk about this very much concern, that can I get a heart attack if I don't get my teeth cleaned and if I don't keep my gums in a good and healthy state? So come, let us have a look at this today's video. Hello and a very happy morning to all of you, and here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. So friends, today we are going to speak about connection between gum problems and the heart attack. Is there really any connection? So the answer is yes. Recently there have been many researches related to the oral health connection and the connection between your heart disease. Friends, it is not only that the pain when it is triggered in your mouth, there is some issue. There are many other things which are symptomatic, or your teeth always show some sign and symptoms. That, especially if I am talking about the soft tissue, then look at this signs by your own self and you can diagnose gingivitis and periodontitis. So look for bleeding gums. If there is any swelling that is coming up, there is pus discharge, your gums look like as if they are moving away from your teeth, or there is some loose teeth that you can see. This bleeding gums can easily be found when brushing, eating, or there is increased sensitivity in your mouth. Also, bad breath is a very good sign that indicates that you can be suffering from oral health diseases or mainly the gum health issues. Now, why is this self-diagnosis test that I told you to undergo? If you are having any of these signs, then you should make sure that you are visiting your dentist as soon as possible. Why? As we all know, there are millions and thousands of bacteria which are present in this oral cavity. Some are good and some are bad. When you are having these gum issues or gum problems, then it is found that these bacteria are seen to build up plaque and calculus on your teeth. This yellowish build-up, the plaque or the calculus build-up, is by the bacteria on your tooth. And once they go deeper and deeper inside the gums start showing signs like these. And these signs and symptoms are somewhere not good, because this same bacteria, they travel down your bloodstream, they reach the heart and the arteries which are present. Now, what are these arteries and hearts and vessels? So these are the supplies which are, these are the pipelines through which the blood is flown. So when these bacteria reach the bloodstream, the blood pipeline where it reaches, then it is seen to have caused inflammation and infection in the places where they stay. Now, who or which place can they stay? Now, we all know that after the age of 30-35, there are certain signs which your body, or because of aging, if you're not having a good lifestyle, healthy lifestyle, or at many times, even if you're having a good healthy lifestyle, there are some deposits seen in the vessels. These are nothing but fat deposits, and this is where this bacteria go and attach. So if that plaque bacteria goes and attach to the fat deposit areas, then more and more plaque build up, more and more fat deposit in that area or in that pipeline that I told you. So in that particular area they can cause blockage, especially in the patients who are suffering from atherosclerosis. Now, if this bacteria reaches your heart, then these bacteria do cause endocarditis. What is endocarditis? It is inflammation of the lining of the heart. So, when this inflammation is caused, the heart shows various signs and symptoms, and this can easily lead to stroke conditions, that is heart attack conditions. So if you are having any of the gum diseases, make sure that you're getting it treated at the right time, because you're 2 times much more prone to have heart conditions. There is a reverse sign also. Your face is called as the mirror of your whole body, or you can say your mouth is the gateway to all the other things to your body. So if it is a mirror, then if you're having any heart conditions, it will easily reflect and your gums will have certain signs and symptoms. Other way around, if it is a gateway to all your body, then this bacteria can easily enter and cause various heart conditions. There is nothing to freak out or blame your heart problems to gum problems, or your gum problems to your heart problems. But yes, how is it still happening and why is it still happening are still unclear doubts, but yes, it is happening. That is very much important. Many a times it is seen post the age of 30 or 40, 50% of people who are having gum issues are having or showing some signs of heart. So friends, if you are having the signs and symptoms, it is very much important that you visit your dentist. Now, if, as we have done a self-diagnostic test, if in this self-diagnosis test you are finding any of the signs, what would you do? Freak out? No. Just visit your dentist, get your cleaning, professional cleaning setting done. With this professional cleaning, what we do is with an ultrasonic scaler or with some machineries and chemicals, we treat the gums. If in certain extra cases, that is when you are having periodontitis, that is when your bones are also involved, we need to undergo small minor surgeries of the gums, and this bacteria can get rid of. Now, your teeth really don't show any symptoms at times, but these gums, if they don't hold your tooth in the place, your tooth without any cavities and bacteria can fall off. So getting this cleaning treatment done is also going to strengthen your teeth and and is going to help your teeth to be in that position for a much longer time. Now, this bacteria is once removed, what is the maintenance that you should do at home is you should always brush twice with a fluoridated toothpaste. Floss. Yes, flossing in between the teeth is very much important that you're going to do. I'm not saying this because I just want you to do some time pass, or I just want to promote flossing or something of that sort. But yes, flossing is a very good thing which you should always and right now start including in your daily oral hygiene practice. How to floss? Here is the video. You can definitely watch the video, and that is going to help you to improvise and get hold of the technique. Once you get hold of the technique, flossing does not take much more longer, in just a minute that you will have to give for oral hygiene. So flossing helps in removing the in-between plaque and calculus, or the food that has been lodged, and that is how you are going to avoid the buildup of plaque and calculus also, and help maintenance of your gums in a much more better way. So friends, along with this use of mouthwash, obviously your dentist recommended regime has to be followed, and at least twice or thrice a week you should have a rigorous use of mouthwash. Properly use it and it is going to show good results to you. Also, visiting your dentist every 6 months, getting your teeth and gums checked, getting your oral health or oral hygiene in a good state is very much important. If you do that, I'm sure you're going to have good heart health, good overall system health. Friends, there is obviously a registered, known, researched connection between your teeth and systemic health. So, a good oral hygiene is a good yes to a good and healthy body. So, with good oral hygiene, I would also say eat right, exercise well, drink plenty of water. This is a great combination pack which is going to help you to keep your health overall in a good state. So friends, this was a video where we have seen is there any link between the heart and the oral hygiene. If you're suffering from gum issues, if you're having all the signs and symptoms which I mentioned earlier, you definitely watch this videos, which is going to help you and have a much better vision on what exactly happens in the cleaning treatment, or if you're having loose teeth, what should you do, what are the treatment options. Do not forget to visit my channel Dr. Mansi Shah, where you get a lot of content related to oral health. Do not forget to comment here and ask your question related to your oral hygiene. Feel free to share this among your friends, because you are aware and make them aware is what a best friend does, is what a good friend does. So because now you are aware, and making people aware around you is what a good friend always does. So do not forget to like and share this video. Friends, wishing you all a healthy, happy and the brightest smile. Stay healthy, stay happy and stay out of it. Thank you.